If you're watching this video, I know you're probably looking like, what am I looking at? Well, let me do the honors of explaining to you what you see. So I was diagnosed with Nutcracker syndrome back in 2023, back in November. And I honestly feel that this is a condition I had my entire life and did not know what it was. So the typical symptoms associated with Nutcracker syndrome are left flank pain. You get like a lot of pressure. They a lot of the times misdiagnose you for kidney stones or UTIs. A lot of protein in your urine, microscopic or sometimes physical, actual blood that you can see in your urine. It's so many different symptoms. So these right here are the blood vessels that connect to my kidneys. And by the way, they are not supposed to be this big. They are huge. So this is the little catheter piece that they use and they inject dye or like contrast, and it basically lights up these blood vessels. So this right here is the nutcracker. This is the compression. So over this is what's supposed to be the superior mesenteric artery, which you can't see. So that superior mesenteric artery overlaps the renal vein, and then behind the renal vein is the abdominal aorta. So that renal vein, which connects to the kidney, is basically being squished. And as you can see, as he shot that contrast through, you see how light it is? And I'll even change it just so you can see at the different levels right there. The compression is right here. So blood is not properly flowing through as it should, as well as the contrast. So he basically stated it's more than 95% compressed. So I'm going to put it on a loop just to kind of show you what it looks like. Horrible, by the way. Very, very horrible. And I'm going to show you some other images. Give me one moment. All right, so before I play it on the loop, I just want to show you what we're looking at. I guess it played itself on the loop. So this right here, in females, they are called ovarian veins, and I believe in males, they're called gonadal veins, but they're basically gonadal veins. My gonadal veins are huge. They're not supposed to be this big at all. I believe the measurements, he said mine are greater than 10 millimeters, and I think the average size is like 6, 5. They're huge. So basically with the gonadals, the blood is supposed to go up and then it's supposed to go back across. So I'm going to show you what happens when he shoots that contrast. It drops right down for me. You literally see it gets up to a certain point and then it goes right back down. And these, I believe, are collaterals where my body just created these extra blood vessels to help compensate for the extra blood flow. Now this stuff right here, this is pelvic congestion syndrome, honestly, that you can see on a venogram. These are all of these blood vessels and stuff down here. They are not supposed to be that big. It is very painful. Pelvic congestion syndrome is what I was diagnosed with first. And it's many different symptoms with pelvic congestion syndrome. You can have pain during or after intercourse. Very painful periods. It's painful. Let me just say that it puts a lot of pressure in my back. It's kind of like having varicose veins, but literally inside your uterus and inside your pelvis. So because of those huge gonadal veins and the blood flowing, it put a lot of pressure on the blood vessels down here. So I'm going to show you on the loop kind of what that looks like. Ooh, I'm over here changing the contrast of stuff. So literally you can just see. And this is the other gonadal vein on the other side. So you can see this gonadal vein. I'm trying to see if I can catch it on a pause to do a comparison of the two. They're not the same size. This one is way bigger. So this is my right gonadal vein. This one thankfully does not reflux, but it is bigger than it should be because it's compensating for the extra blood flow. So all of this right here is not supposed to be. So I'm going to just take it back to the main image. So like I said, if you are dealing with any of these symptoms, make sure that you get the proper care. If anybody was recently diagnosed with pelvic congestion syndrome or nutcracker syndrome, please, please, please do your research. These folks will be quick to try to coil you. I thank God that I did not get coiled when I was diagnosed with pelvic congestion syndrome because I found out that there was a cause. So this nutcracker syndrome, this buildup in these pressures of my kidney veins caused the blood to come down and pull into my pelvis. So if I would have got coils or stents, all it would have done is make the pressure build up here. Literally, I was told that I should be on dialysis. My kidneys should be done. But the fact that my body created collaterals, it allowed that extra blood to reroute to where the pressure did not build up. Now, granted, it still is building up. And I actually supposed to see a nephrologist at the end of this month, finally, after 3 years. Wait, right? But any questions, please don't hesitate to ask. And I just wanted to show you guys this imaging because I think it's cool.